There are all kinds of people here at Carle, many different skills and abilities, but we all have one thing in common, and that is that we want the best for our patients. We want them to have less pain, less discomfort, easier breathing. We want them to be able to have better times with their families. That is often the case, but unfortunately, every day we encounter situations where that is not true, and where, despite our best efforts, there are really no good options to provide for the patients. In those situations, we have to sort out between several different difficult options. Over the years, we have discovered that one of the best things that helps our staff do that type of thing is the Carle Ethics Committee. This has been designed and running for a number of years, but we still find it very useful in helping our care providers, our families, and our patients sort out some of the more difficult treatment and life change questions and try to get the best answers possible.
The Ethics Committee is a committee that was formed in the hospital to provide help and assistance to staff, patients, and family members when confronted with ethical questions that are involved in their care.
The Ethics Committee is actually a couple different things. There's the Ethics Consult Team that performs functions at the bedside with the family, with the patients, with the physicians and nurses. And then the second part is a larger group called the Ethics Committee, where we review everything that's been done. We review policy here at the hospital. We review new innovations that need to be added to our system, and we're also responsible for ethics education.
They meet on a monthly basis and discuss ethical issues that go on in the hospital on a regular basis. They also are available to do ethic consults on the units or in any area in the hospital that requests their assistance.
The consult team is usually headed by a physician, but it always includes people who are not physicians, social workers, nurses, chaplains, and others who will then typically go to the bedside and sort out the situation, try to find out what the real facts are and what the real questions are. And then we try to respond with kind of an outside the immediate reference, kind of an independent look at things and see if we can offer any insight or help, particularly with reference to American law, hospital policy, and standards of ethics that are widely accepted.
I think that the ethics team or the consult team can oftentimes help not only the patient and the family, but the staff that's caring for the family, and that's a critical thing that people need to remember. Oftentimes the staff may be confused and may not understand if what we're doing is the right thing, if there are other things that we should be doing, are there other services that we should be providing to the patient and or the family. And so I think that the nature of an ethics consult oftentimes is educational in nature and supportive in nature at the same time.
There are several kind of standard situations. One is if the family and the patient are in some form of disagreement with the treating team about long-range goals or immediate therapies that might be used. Another one is just trying to figure out what a patient would have really wanted at the end of their life. Sometimes families ask the physicians and the nurses to do things that in fact are not legal or ethical, and sometimes we can get involved in situations like that. There are also times when different members of the team may be having different opinions about where we should go with treatment, and sometimes that happens between two different physicians or perhaps between a physician and the nursing team or therapy team.
Well, it's never wrong to ask, and you can always make the phone call and ask Dr. Cranston or any other member of the team and say, is this an appropriate ethics consult? But we encourage people to go first to their immediate supervisor and ask them. Most of the supervisors in all the areas know when it's appropriate to call an ethics consult.
For instance, if you're having a problem between two nurses, the normal line of responsibility would be to talk to the more senior administrative nurse responsible for that unit. It wouldn't come to the ethics committee. Likewise, if it was solely between two physicians and did not involve the patient or the nursing care team, it should be dealt with on a medical staff level. But it's when things cross departments and cross specialties that this usually comes into place. And it's usually major decisions. Minor decisions can usually be hashed out, at the bedside with the team.
Often nurses will call an ethics consult when they're doing care that they feel is inappropriate based on the patient's condition, or they just feel uncomfortable with the way the case is going.
That's actually one of the beautiful things about the Carle ethics system. In some of the larger university systems in the country, only certain people are allowed to request an ethics consult, like fully established physicians or physicians with full admitting privileges. But at Carle, we've long held that the nurses are an extremely important part of the team. The social workers and the chaplains are too. And even if the family has a major concern, they can come directly to the ethics committee if they feel like they're not getting the answers they want at the bedside.
We're trying to make it easier by putting some structure on the Carle web so people have a little bit more guidance in terms of deciding which service they really need. Is it an ethical question? Is it a medical staff question? Is it a care question? But anyone who needs a consult can ask for one. We're willing to provide the service.
We try to make this as simple as possible because we don't want somebody who's already in a tight situation to have to jump through hoops. Anyone is allowed to call the Carle Communications Center, and on a ward that would be done by just picking up a phone and dialing 0. And then you can ask for an ethics consult to be initiated. If you wished to have that done anonymously, that would also be possible. For instance, you could call up and say, I'm a concerned family member and I would like the ethics committee to check on the situation with Mrs. Jones in room 427. That would be completely appropriate. And the communication center would then notify me or one of the other ethics consult team members, and we would go to the bedside and try to begin figuring things out.
Once we get the committee together, we go to the unit where the ethics dilemma is at, and then we look at the chart and we get a good history. We have a form we fill out that discusses a complete history of the patient, why they're hospitalized, and any other comorbidities they might have had before they came in. Then we get a good family history. We usually talk to the social worker or case managers on the case so we can get a good family history. And we talk to all the caregivers, the physicians, nurses that have given care to the patient.
Sometimes after the ethics team gets to the situation that's the troubling or the nut of the problem, they discover that really a lot more communication needs to happen between family members and other family members, or between family members and nursing staff members or physicians. Sometimes the communication difficulties are significant enough. What we really need to do is get everyone in the same room to sit down and talk about it.
I think that one of the wonderful things that comes out of a family conference is an understanding on the part of the family that what they really have to focus on is what does the patient want, not necessarily what we as the family want. Obviously that's very important, but at the root of it is what does this patient want, what did this patient express, either written or unwritten, to people that they love and care for.
Well, we really want to encourage communication. And so one of the things that we have put right into our whole system is something that in some situations is called the whistleblower protection. If a person in good faith asks for a consult, there are no negative ramifications. They can even do it anonymously if they want, but we will take all such requests seriously. If we were to see a pattern where numerous requests were received and they were inappropriate, I'm sure we would have to talk to the person a little more directly. But in general, we check it out, we try to give them a straight answer, and there are no negative ramifications of an inappropriate request.
Well, I think that people should remember recently that the Foundation Quality Committee approved our definition of quality, which is doing the right thing for our patients every time. And what that means is that even if you're not completely sure, but you think it's something that you need to do, then you need to do it, because at the root of all that we do is the patient and what's best for the patient. And so if there's a question, a potential question, I'm not really sure, please call.
If you want to find the ethics committee and any information about them, you go on the CWeb, the front page.
There are 3 columns on the home page for the CWeb. In the middle column, if you just go down about 15 from the top, you just look for the category that says ethics, and that'll get you started right there. But again, the other thing is, anytime you want an actual consult or even a phone consultation with somebody from the consult team, that can be obtained directly through the switchboard.
The ethics team and the ethics consult team is there to assist you at these times of need, both for you and for the patient and for the family. Please feel free to page me, contact the consult team, consult the ethics team if there's any way that we can assist you.